We started our SBIRT program in August 2020 with support from the Martinsville Initiative. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It's a public health approach to identify alcohol, tobacco, or other drug use that can impact a patient's health. So if a patient comes into the emergency department, they may have underlying health risk behaviors, and by addressing them there and early, we can prevent future health complications.
So the screening process is when I go into the patient's room and talk to them, usually after the doctor sees them, and using validated tools such as the PHQ-9, which is the Patient Health Questionnaire, the ASSIST, the DAS, which measures substance use abuse, or the GAD-7, which measures anxiety. And depending on how they answer those questions, then I do follow-up questions. So I work a lot with the different rehab and detox facilities because it's my job then, if I identify somebody as high risk, to get them connected, whether with mental health counseling and or MAT programs, depending on what they're using. I try to network with as many detox facilities, rehab facilities, counseling facilities, and doctors' offices as well.
The Martinsville Initiative is a police, school, community, health, and education partnership. The program was founded in 2017 with a grant from Kukli, Combating Opioid Overdose with Community-Led Intervention. Since 2017, we have expanded and grown, and all the work that we do is centered around the mission of preventing substance use, building strong families, and empowering the community. SBIRT in WVU's emergency department helps us to meet that goal in many ways, including an avenue for referrals to be made to the Martinsville Initiative of families and children in substance use. Once the SBIRT team completes their screening and does their work, if they identify a family, they make a referral to the Martinsville Initiative, and then we start our risk stratification protocol process so that we can provide the most appropriate interventions for the families.
So in addition to substance use, we also look for mental health issues, things like anxiety and depression that can also play a role in substance use and have an overall impact on your health. So we'll provide the SBIRT brochure, referrals to outpatient treatment when necessary. We also have a lot of patients that need counseling or therapy, and we can set them up with that. We're really fortunate in this community that our partners are really connected. One way that they connect is through a community group called Bridges, so that allows them to share data, information, new programs that are available. And as Linkage to Care coordinator, I'm really involved in that group, and I help translate that information to our SBIRT providers. And I also coordinate the substance use disorder programs here within the hospital.
So the greatest impact I get is when a patient calls me up and lets me know that they're doing well, they're staying in school, they're not using substances, they're making it to work, their family life is getting better. Several patients have contacted me and said, "Hey, I can't wait for you to see me again. I'm doing really great." And that's what makes the job worth it.
In our 2019 Community Needs Assessment, substance abuse was identified as the highest need for both Berkeley County and Jefferson County. The SBIRT program is an excellent strategy for us to be able to meet the needs of our community and to deliver it in a location where our community needs it the most, which is the emergency department.